sports, and your Weather Authority forecast. This is 13 WHAM News and High Definition, your breaking news and weather authority.
More fallout from the VA scandal. We're now learning that there were up to 1,700 veterans on no waiting list, but waiting for medical care at a VA facility in Arizona. As Christine Frizzell reports, some now see this as ammunition for a VA overhaul, while others are weighing the potential of vouchers.
For 33-year-old Brian Mast, returning from war meant fighting a new battle, learning how to live without his legs. He lost them to an IED in Afghanistan back in 2010.
It happened in a flash, you know, just as quick as you turn on the lights in your home, that's as quick as it happened.
He spent about 18 months at Walter Reed, but once he retired from the military, he opted not to get care through the VA health system, even though he's entitled to it.
The VA facility that I go to, there's basically 1 day a month to go and get prosthetic care. For somebody that works, to have to go on a Thursday, 1 day a month, and that's the only day that you can get there, that's a very inconvenient thing to do.
His story is like so many others, and the reason Congressman Andy Harris wants to give veterans a new option. Harris, a Navy veteran and medical doctor, is pushing for legislation to create a medical voucher system for service members.
They should be able to go out and take the money that the VA system would have spent on them and go out and buy private insurance. And I'm convinced that the vast majority would be able to get a very good policy for the same amount of money.
A central question now is how much these isolated instances represent the VA as a whole.
According to the New America Foundation's Philip Longman, it's the best system we have.
The VA healthcare system, by many, many metrics, outperforms the rest of the U.S. healthcare system as a whole.
But for Harris, the idea might be somewhere in between. Start with newer veterans and then go to those with the most serious medical needs to give them a choice.
The average cost per veteran, for instance, Priority 1 veterans, is almost $12,000. You can buy them an insurance policy, one of the silver plans on the Affordable Care Act exchanges for much less than that.
For Staff Sergeant Mast, ideas are a good start, but he hopes change will happen as soon as possible.
To think that on Memorial Day, I'm going to have to remember veterans that were lost to us because they didn't receive care, because they were put on some false waiting list at a Veterans Affairs facility. That's the most dishonorable thing that I can think about.
I'm Christine Frizzell.